I will conclude our speaking program. Rhode Island Kids Count is deeply, deeply appreciative of the leadership of Representative David Morales and Senator Cano. They have been tireless champions of this issue. They have put their heart and soul into the bills that they have sponsored, S566 in the Senate and H5714. Rhode Island Kids Count strongly joins with our colleagues and our advocates that you see and many more in strong support of passage of this bill that will provide health coverage for all kids, regardless of immigration status. We have just been through and are emerging from a global pandemic that has had an absolutely disproportionate impact on families of color and communities of color. This is something, this bill, where we need to stand up and do what's right for our kids. All kids need access to preventive health care. Children insured through Medicaid and CHIP, which in our state is the very, very highly rated Right Care program, are more likely to receive primary and preventive medical and dental care, have access to specialists, and have fewer unmet health needs than uninsured children. Evidence indicates that Right Care and Medicaid has reduced racial and ethnic disparities in access and utilization, improved educational outcomes, and shielded children from poverty. In our state, we need to understand, as Dr. Pat Flanagan just said so well, that this is an issue that impacts all of us. Our children, including undocumented children and children regardless of immigration status, have access to public education, and that is where children belong. But to say that some children should have health care and others shouldn't makes no sense from any level, morally or in terms of the higher cost of paying for emergency care that could have been prevented. We need our kids to be healthy in school. We need our kids to have required immunizations. We need our kids to be able to have preventive child visits to prevent costly conditions that cost them of their happiness and their health and their educational outcomes. The time is now for Rhode Island to do what it already has done before, which is to pass these bills that will make sure that all kids in Rhode Island have access to health insurance coverage regardless of immigration status. We are almost at the finish line in Rhode Island. We have 98.1% of our kids covered. We are almost at 100%. We are second best in the country. This is the bill that we need to join with other states that have said all kids need health insurance coverage regardless of immigration status. The time is now. We need to join together. We need to do all that it takes to pass this bill this session. I want to end by thanking the sponsors of this bill, Representative Morales and Senator Cano, and all of the other sponsors who have been mentioned who are fighting tirelessly for this bill. The time is now. Our kids deserve this. Our families deserve this. We need to pass this bill. Thank you so much for joining us today.